Yo, what's up? Eric Wong here from precisionmovement.coach, and today we're going to go through something called the FADIR test, F-A-D-I-R, and this stands for Flexion, Adduction, Internal Rotation Test. Okay, and this is a test for hip impingement, also known as femoral acetabular impingement syndrome. Okay, so if you're wondering or you've been looking things up and you're wondering if you have this quick test can kind of indicate if you have this or not. All right. So all you're going to do is you're going to lie down on the ground and you're just going to bring up, flex your hip, and then you're going to adduct your hip. So F-A, so adduct, A-D, adduct. So flexion, adduction, okay? And all you're going to do is turn your heel out there while pressing your knee in to adduction and down towards the ground, okay? So I'm pressing in, and then I'm just going to internally rotate the hip. So you can see my foot going out that way. Now, this test is positive, basically, if you feel a pinching sensation in this area, kind of in the anterior aspect of the thigh, or even a little bit more medial. Okay, so somewhere in the front in this area, if you all of a sudden feel, once you get that internal rotation, if you feel a pinch in this area, then you've tested positive for femoral acetabular impingement or hip impingement based on this test. Okay, so if you tested positive, now this is not the end of the world, and actually the reality is that this, a lot of doctors and surgeons, they'll say that this is a structural issue and your options are either to live with it or to have surgery. I was actually told that myself, but that's not the case. There are other options out there, and you can actually develop a very high level of functionality to the point where you're not really limited by anything if you test positive with this, if you do the right things, if you take the right steps and get your body working properly. Okay, so if that's the case, you want to learn more about FAI, femoral acetabular impingement, and what to do about it so that it doesn't limit you, then check out the link at the end of this video or in the description of this video, and you'll be taken to a blog post where we're going to discuss more about femoral acetabular impingement syndrome and what to actually do about it. All right, so hope you enjoyed that video. Talk to you next time. Peace.